Good morning, everybody. I'm Dr. Nadir, Assistant Professor of Solid State from University of Benghazi. I will introduce my work with my team about the intelligent spectroscopy, merging Raman, and artificial intelligence, and electronics for advanced medical diagnosis and treatment, which is the giant work and it's the main work about Raman in this period of time. First, we will talk about the clinic motivations. What is the motivation behind that work? Actually, the 100% of our work is going to help people, sick people, patients, and such kind of people that they are suffering a lot during a lot of procedures. And we found a good way to be able to minimize that suffering. And we think that we got it. First, clinics need fast and accurate diagnosis, and that's and the couple years it's hard to be accurate diagnosis and fast. And our technique is that we can minimize the times, and you can imagine that in some cases of diagnosis, instead of 3, 4, 5 days from testing and go on, we can get the diagnosis in half an hour or in a couple of minutes, and that's great. That's great, depending on this technique. On the other side, traditional pathology is invisible and slow, mean this surgery and working slow, and in some cases that mean a cost life, and we try to save that life during our technique. Optical, which we mean Raman when we talk about opticals, and the artificial intelligence tools enable real-time decisions, means on time we can have the decision to go on through the case. We go to Raman spectroscopy simple view. Before everything, we have to give a good idea about Raman and just simple idea. What's the Raman spectroscopy? Raman spectroscopy dealing with the electromagnetic waves and the range of electromagnetic waves, and what we can get from Raman, we get from Raman signal, and that signal simply which we depending on it to build up our work with in combination with AI. And that's good, but from other side is we want to talk about Raman itself. Without AI, it's very hard to have a good idea about the work, and it's hard to be used alone to perform this work. Why? Because this Raman has weak signal and has noisy signal, and without AI, artificial intelligence, it's hard to get that, and it's hard to perform your work. So that we use light to read molecular fingerprint. We use light, as we say, this electromagnetic waves. So we can have a good idea about the molecular fingerprints and the structure of the molecular, and that's a good idea, which is mean that we get the point. We get the point, especially in a couple of diseases like cancer. No stains, no labels, no tissues destruction, and that's nice. Just to remind the people and the researchers, the live tissues is very sensitive, and when we use a couple of kind of radiation, for example, X-ray, gamma ray, and the neutron and the protons, that means we damage this live tissue simply. This damage going is to reach 40 and 50% from live tissue. In our case, in this technique, the damage doesn't go more than from 2 to 5%, as is 5%. We say that's that's worthy, and it doesn't reach 5%. We are dealing with the ratios from 1 to 2 to 3%. So that it's excellent to deal with such kind of technique in the medical field. Also detects biochemical change in disease. What mean of detect biochemical change in disease? A lot kind of disease, depending is going build up the disease on the change of the live tissues. And in some cases, during the change of live tissues, couple of live tissues, it could not be seen the change in it, whether that is already attacked from this disease. The Raman spectroscopy with AI could show us and ensure for us the attacked live tissues. And depending on that, we can have the good decision to work with such kind of tissues and how to deal with it. Why the artificial intelligence is essential? Why we say that is medical spectra are complex. That's from what we say. It's clear. The artificial intelligence learns disease patterns automatically, and that's a good point to be explained. How? Actually, the artificial intelligence has a database, a big bank database. Depending on that, it could directly detect the tissues and detect the kind of disease and give us a good idea about what we are working or what we are dealing with. Also reduce observer variability, and that's also a good point, which is it's helpful. It's helpful, and in the end, we are provides clear diagnostic output. Means that we can point our finger on the pain. We can say, yes, here we got it quickly and precise. This diagram just to show us the artificial intelligence workflow intelligence spectroscopy. Starting from Raman signal, which we said is, if it's alone without AI, is too weak, but here in combination with AI, from Raman signal acquisitions, also pre-processing, clean data with AI feature learning. In the end, we will get it. We will get clinic decision, and we can say that the decision is 100% in the right direction. The key medical applications, and actually it is it's important. It's important. It's excellent. First, we are talking about the horrible disease, cancer, and which is myself suffering from it till today. Cancer detections during the endoscopy. Normally, it could be shown, it couldn't be detected without surgery or take biopsy from the place which is think that there is something inside it. But with this technique, AI with Raman, the detection during endoscopy without any surgery, without any biopsy, just to check it by the laser line, and you can decide whether that place and that piece of the places has cancer or has no cancer. Also, tumor immersion guidance in surgery. During the surgery, in some cases, the doctor cannot decide exactly. Yes, he has a good idea. He has CT or MRI, and he can decide and determine the place which is already attacked, but he has no idea till 90 or 100% about the accuracy of his work. Raman and AI, the artificial intelligence, give the doctors the row on the road and decide to him which place he has to remove, which he has not to remove, and that's also excellent, and that's reduce the suffer and reduce pain, and reduce the time of recovery. Blood-based liquid biopsy screening, and that's also excellent during this technique. In inflammatory and metabolic disease also could directly detect it depending on the AI with Raman, depending on database which we have. We go to the intelligent spectroscopy versus histopathology, and a small comparison between both of them, and we will see clearly how it's different. In the case of histopathology, as we need to have biopsy required, no way to decide, to have decision about the disease without the biopsy. And the intelligent spectroscopy means AI with Raman. It's just a light probe only, not anymore. And you can get the good idea about the disease and what we are dealing with. Histopathology needs hours, sometimes days. Intelligent spectroscopy, actually, we don't need more than seconds, moreover, to reach minutes. And I remember some cases of the COVID-19. The people were suffering a lot because to get a result about the test dose, it takes a couple of days. In the Raman case, you don't need to wait for a couple of days, just half an hour, and then they reduce it to per minute to have the result. And that's excellent. That's excellent. The histopathology is subjective, and intelligent spectroscopy objectives. The difference is here. Histopathology, lab-based, means we have to work in lab. Intelligent spectroscopy is just point of care. I mean, it's more simple. It's more public. Yeah. Okay. The clinical advance, non-invasive, in this excellent. We don't need to have surgery to build up the idea about our cases, to decide whether that this case has this disease or not, depending on our technique, real-time results, and that's excellent. Reduce the time of the results. We can get the results in very, very good time to have a good decision clinically. Objective diagnosis also reach 90% to 100% and support the precision medicine. And that's excellent. That's what the doctors in the clinic looking for. After that, we go to the challenge and next step. It's explainable in artificial intelligence for clinicians' trust. And this important for the doctors when they are dealing with such kind of technique. They can build up on that technique, and they can be sure 100% that we are working and going in the right direction. Also, standardized clinical protocols and means that we can unity the protocols which use in the clinics. Also, multi-center validation studies, and that's excellent. That's excellent in the cases which we are dealing with. We say that a take-home message from this intelligence, artificial intelligence, and Raman spectroscopy with electron, intelligent spectroscopy combines clearly physics and artificial intelligence and engineering. This, let us say, combination, each part of it is essential, is a main part. No work, no technique without one of these three parts. Also, it enables fast objectives and molecular diagnosis. And from our declaration in the latest slides, we clarify how it looks like that, how it works like that. Strong potential for future clinical practice, and actually, the people still working on that. And, actually, myself, I collected a lot of data from Nottingham University Clinic in UK, and there was another clinic in USA, and in Germany. I got some data from University Clinic, and that was really helpful. And whether that if you can read the paper, you can see more information about what we got. And then thank you for pay attention. Have any question, please?